Rheumatoid arthritis is an autoimmune disease where antibodies attack the lining of joints, destroying the linings and subsequently causing arthritis in the joints. It progresses to destroy tissue around the joints as well. Damage is done both by the inflammation and antibodies. Symptoms include pain and stiffness in joints, especially in the morning, swelling and deformation of joints, fever, fatigue, and weakness. Furthermore, in about 40% of patients, the inflammation created by the immune system's attack damages the body's other systems, such as lungs, heart, eyes, and mucous membranes, causing dryness, and skin. In later stages, joints become severely distorted and nodules may develop. Patients with RA are at greater risk of developing lymphoma. Let's look at diagnosing RA. This disease usually attacks smaller joints first in the hands and feet. Pain and swelling often appears bilaterally in the same joints. On X-ray imaging, the damage caused by RA appears to be distinct from that caused by the more common osteoarthritis. Compared to osteoarthritis, there is more room between the joint surfaces with RA, but the joint surfaces are more eroded. In blood work, specific antibodies known to be associated with RA may be revealed, and a protein linked to inflammatory disease, C-reactive protein, may be found. Additionally, a lab blood test for erythrocyte sedimentation rate, SED rate, is a strong indicator for inflammatory disease. The triggers for RA are unknown, but as with other autoimmune diseases, genetics appears to be a factor and environmental causes are suspected. Over 1.3 million Americans suffer from RA. It can strike at any age. Most patients come down with it by their 30s. It affects women 2.5 times more than men. Treatment includes anti-inflammatories, immunosuppressants, and biologics to attack molecules which produce inflammation in your joints. Surgery may be employed to replace some joints to relieve pain and improve function. Biologics are medications or vaccines produced from living organisms or their components. You can help manage your RA symptoms if you are physically active, keep a healthy weight, avoid injuries to your joints, avoid activities that have repetitive motions like bending your knees over and over, stop smoking or don't start. Test yourself. Rheumatoid arthritis occurs when A. Red blood cells clog the joint spaces. B. The body's antibodies attack the lining of joints. Correct answer is B. Rheumatoid arthritis occurs when the body's antibodies attack the linings of joints. What percentage of RA patients experience damage to other body parts besides the joints? A. 40%, B. 4%, C. None. Correct answer is A. 40% of RA patients experience damage to other body parts besides the joints. Which of the following can be used to help a doctor diagnose RA? Patient's report of symptoms, X-rays of the joints, blood work, all of the above. The correct answer is D, all of the above can be used to help diagnose RA.